The guidelines your doctor follows may be influenced by the companies that make the drugs. Many patients don't realize how those guidelines are actually created and how pharmaceutical funding can influence the research behind them. Clinical guidelines are recommendations written by expert panels that tell doctors how to diagnose and treat disease. They determine things like when you start cholesterol medication, how blood pressure should be treated and managed, what antibiotics are recommended in certain situations, and what therapies become the standard of care. These guidelines influence millions of medical decisions every single year. To write these guidelines, expert panels review published clinical research. An important detail, however, is that a large portion of pharmaceutical research is funded by the companies that manufacture the drugs being studied. This is because it's actually the pharmaceutical company's responsibility to fund the clinical trials required to bring a drug to the market. This relationship has been widely studied. For example, research has shown that industry-funded trials are more likely to report results favorable to the sponsor's drug. That doesn't mean that all research is invalid, but it does mean funding sources can easily influence which studies get conducted, how the study is designed, and which outcomes are emphasized. Another area researchers examine is the financial relationships between guideline panel members and industry. For example, analysis of guideline panels for cholesterol and diabetes treatment have found that some members had financial ties to pharmaceutical companies whose drugs were being evaluated. Most organizations now require these relationships to be disclosed, but disclosure doesn't necessarily eliminate bias. When guidelines change, such as lowering the threshold for diagnosing high blood pressure or expanding recommendations for cholesterol medications, that can dramatically increase the number of people eligible for pharmaceutical treatment. A good example of this is when the American Heart Association updated their blood pressure guidelines in 2017. Millions more Americans suddenly met the criteria for hypertension. Changes like that can influence how widely medications are prescribed. Now, don't get me wrong, clinical guidelines are obviously an essential and important tool in medicine, but when you understand how these guidelines are created, you can start asking better questions about your care.